If you had to write a comedy routine, would you go to a comedian for advice? Or would you go to someone who studies healthcare policy for a living? Obviously, you would go to a comedian. So, as our country deals with a healthcare crisis, why are some comedians trying to tell us how to fix it?
I'm by no means suggesting that I am an authority on this issue.
That was Canadian comedian Brittlestar at the beginning of his new video on healthcare reform. If Brittlestar doesn't know much about healthcare reform, it begs the question, why is he even talking about it?
I mean, he has made clear that
His video contains a number of errors. First, he claims that some politicians want to introduce private healthcare. The only problem is, he's late to the party. Your family doctor's office is actually a private business. You walk in for a medical appointment and walk out without paying a bill. That's because your doctor's office bills the government and they pay for it with tax dollars.
Boom. Knew it. Tell us about it, please.
This also happens sometimes when you go to a clinic to get your blood tested or to receive an MRI, and even for knee and hip surgeries in some provinces. Governments hire private healthcare providers because it's more often cost-effective. Brittlestar seems to kind of understand this.
The drive for profit ensures less wasting of resources and a desire to keep things lean and mean so you can increase profit.
But Brittlestar doesn't understand how business can make profit and still charge less than what it would cost the government to do the same service.
Private enterprise cannot survive by serving a community. Again, they need to make a profit.
Consider that when you walk into your family doctor's office, you don't see layers of bureaucracy and executives walking around.
Fine. We'll just start by drawing some blood. Well, isn't that odd? It's like poking through meringue.
The staff that are there to help you. The Ontario government wants to try using private clinics to help patients with more surgeries. And that's a good thing. Saskatchewan did this and they reduced their waiting times while saving money. The private clinics still had to meet the same quality standard as the public system. The bottom line is private clinics are good for patients. And isn't that the point of the healthcare system?
Here's to feeling good all the time.
To learn more about healthcare reform, please visit secondstreet.org and don't forget to hit the subscribe button.